Currently, we have Surgical Outreach of the Americas, SOFA performing surgeries here at the hospital with us. Today marks day 4 of surgeries, and so far we have completed 47 procedures on 41 persons. Procedures include hernia repair and removing any lumps and bumps that these persons or these patients may have and have come for evaluation on Monday here at the hospital. SOFA scheduled to be here 5 days. They conclude on Friday, April 12th. During the screening, the team successfully scheduled 60 patients to have a procedure done. This includes either the hernia or removing any bump that they may have. As I mentioned, currently it's 47, and the remaining patients are scheduled to be done by this afternoon and by Friday when they conclude their surgeries. On Monday for the screening, we got a surplus of patients coming in. We had patients coming in all over the country. Mainly Toledo district had the largest, but we got out district patients. We couldn't manage and address the issues of all these persons. So we are currently working with the managing team of SOFA on scheduling a visit for early next year where we could address the other persons that came for the screening. Yes, part of Surgical Outreach of the Americas SOFA will be a gynecologist coming down from the US to be with us from April 15th to April 19th. The gynecologist will be focusing on females that have had an abnormal pap smear report. So they came in, they did a pap smear, and then when the report came in, it was abnormal. That is one of the points. 2, the Ministry of Health and Wellness implemented the HPV self-testing kit, which is the human papillomavirus self-testing kit. If anyone did that test and the test was positive, you would need to visit the gynecologist during that week. It would be advisable to come in and have the gynecologist review that result. The third point would be any female that has been having bleeding or pain during sexual intercourse would be advised to come and have the gynecologist do an examination on them. And the last one would be if you have visited any physician, any doctor, and they have told you need to see a gynecologist, then I think this is the opportunity where we will have the gynecologist in for 1 week having a look at these patients at the Punta Gorda Community Hospital.
We also spoke to Tom Wade, a general surgeon, and this is what he had to say.
See procedures on over 50 patients this week. We've had really wonderful support from everybody here at the hospital, the nurses, the physicians, and all the way up through the health ministry, just sort of making this trip possible. It's been a lot of work over a couple of years to get here, and so we're very excited to be here, and we've had a really successful week. So I have been out of training for 8 years now. This is my 6th or 7th trip with Surgical Outreach for the Americas. It's always a wonderful experience. We love going down and helping people when we can, providing the services that maybe aren't available locally. It's one of our favorite weeks of the year because we get to come down and just provide care without any thoughts of all the sort of administration stuff you do in your normal workday. It's just sort of pure medicine, which is really rewarding. Never really know. It's our first time down here, and so on Monday was when we had our clinical day, and obviously we had lots of patients, so there's plenty of need. We filled up this week. We're in the process of filling up most of the next week. We're planning to hopefully come back in January, and so there's great need. Every patient that we met was very happy to see us, very helpful and excited about the opportunity to get care. And certainly there's a need, then we're happy to help. So things are going really well. So we're running sort of 2 rooms. One room we used for the low lumps and shorter procedures where patients were awake. And then we have a full operating room where patients are going to sleep. And then they'll have their surgery, they'll wake up in the recovery room, and then they've been getting great care after that here with the local staff as they recover sort of overnight if they need to or later that day. Procedures have been going really pretty smoothly. I think we would just want to thank the community for having us. Obviously, it's a big undertaking for everything to get done. There's lots of work had to happen before we ever came down here to be prepared to do these surgeries. I understand they haven't had surgery here for a number of years. And so, all the work that went to get us here, all the work that's done by the staff while we're here, and the community for trusting us. I know we have people that they don't know us at all. We come down here, it takes a lot of trust to come and see us and allow us to help. And so we're really grateful for that.